Okay, let's talk about unexplained infertility. I kind of feel, I want to ask you what the definition is, but I want to start by saying unexplained fertility, probably in your field, is a little bit similar to when I had to tell someone, I don't know why they're having pregnancy loss. Because everybody wants an answer. And I get that.
Right.
You want to have an answer because if you have an answer, then hopefully there's something that you could do to fix it.
Right.
But unfortunately, there's unexplained infertility and there's unexplained pregnancy loss, unexplained recurrent pregnancy loss. And we don't always get answers. So speaking of unexplained infertility, what exactly does that mean? And then what percentage of infertility cases are due to unexplained infertility?
Yeah. So unexplained doesn't mean that there isn't an actual explanation. It's just we don't have the tools to get to the bottom of it. Usually, broad strokes, it means the HSG was normal. So your tubes are not blocked. Your uterine cavity doesn't have any known issues like a fibroid or a polyp in the inner lining that could be taking away surface area from where an embryo would want to implant. And the semen analysis is normal. So it doesn't seem to be a sperm issue from the limited testing that we can do. But we can't get as nitty gritty as we would like to. We don't know how to test for egg quality. So that's a huge blind spot. We make assumptions based on age, and any good doctor knows that you can't really reduce a patient down to a category or a number based on something written on a piece of paper, but that's the best that we can do. And, even sperm quality, yes, the concentration and how it swims and how it's shaped can tell you a lot, but does it tell you about things like DNA fragmentation? And the testing that we currently have for DNA fragmentation is controversial because, some studies have shown it's not always reproducible. And, we just don't really understand how valid it is. So you can't get, you can't know everything there is to know. And some of the cases of unexplained might be things like endometriosis that, you might not really put across in your history of, okay, did you have painful periods? Well, you lived with these periods your whole life. So a lot of times women with endometriosis might not recognize the signs or symptoms. And sometimes it can be really subtle, but that can cause infertility in a good chunk of cases of unexplained infertility. So there's a lot of things that really can't be seen with the untrained eye or even with testing with the trained eye. And that's what we're lumping in as one thing, unexplained. And that's why the main treatment at the very least is doing things on both ends, both the egg end and the sperm end, taking medication to give your body the chance to release more than one egg, things like Clomid or Letrozole, and in some cases injectable medications, and doing an insemination where you're washing the sperm, concentrating it, and injecting it closer to where the eggs are being released. Because if you just focus on one or the other, that's not going to be very effective. Studies have actually shown that. Really well-designed studies, large-scale studies in multiple centers have shown that. So it's really the combination of the two to be efficient because you don't really know what you're treating.
And then what percentage would you say, or do we know have a percentage?
Yeah, we normally say 15%.
15, okay. Or due to unexplained infertility. Okay.
Yeah.